Cervical cancer is the second most frequent cancer among women in Ghana after breast cancer and is prevalent in women between the ages of 15 and 44 years. These cancers have been named as the most common causes of death among women in Ghana. Most women diagnosed with either one of these conditions are mostly detected late, often resulting in death or late treatment, which are usually expensive. As part of efforts to provide health education and solutions to these problems, the National Radiotherapy Oncology and Nuclear Medicine Center at the Kolebu Teaching Hospital, in partnership with the Shai Osudoku District Hospital, Bator Catholic Hospital, and the Queen Mother of Dodowa, organized a breast and cervical cancer screening for women at Dodowa. The beneficiaries were examined for breast cancer and underwent a pap smear test. A clinical oncologist with the National Radiotherapy Oncology and Nuclear Medicine Center at the Kolebu Teaching Hospital, Dr. Samuel Ntiemu Boaten, said they would ensure that anyone identified with any symptoms will be supported to undergo treatment.
We get a lot of referrals to our department from this area, so we decided that it would be good to move in here so that with this breast cancer screening, we can detect breast cancers early. If you're able to detect breast cancer early, you can get the right diagnosis and offer early and appropriate treatment. The more advanced the cancer, the more difficult it is to manage, and the more sophisticated the treatment becomes, and the more expensive. So the earlier you detect and treat, in the long run, it becomes cost effective. We've seen a few cases since we started the screening who would need further investigation, and we'll take it from there. So we've asked them to report to us in Kolebu. We've asked them to do mammograms and ultrasound scans. So that will help us to see exactly what is going on in the breast. We found some lumps we think might be cancerous. So after the mammogram, then we will do a biopsy. Then if it's confirmed as cancer, then we'll start the treatment as soon as possible. And because we are celebrating our 25th anniversary, patients will have subsidized treatment costs. It might actually even be free. I must say that treatment of breast cancer, parts of the treatment are actually covered by the health insurance.
According to Director of the Shai Osudoku District Hospital, Dr. Kennedy Brightson, an early detection of both breast and cervical cancer guarantees a greater chance of cure, hence the screening.
Collaborating with them, together with the Catholic Hospital in Bator, to do this screening, not particularly because we have a lot of cancer cases in the district, but because we want to whip up the interest in preventive healthcare, preventive medicine. We have what we call one of the best wellness clinics in Ghana here in Dodowa, and we have a cervical cancer screening center. So we don't want it to lie idle. We go to town to run community services to them. But this is an advantage for us to bring everybody on board. So that's why you see so many people. And we believe that from today going, in fact, today we'll be able to pick a lot of cases today. And then from today going, people will develop that interest in preventive healthcare. It is important to spend some little money to examine yourself and be sure that you are healthy than to wait until the disease is fully blown in you and you spend thousands of cedis, and above all, your parents will even spend, your family, so much money to buy a coffin for you. You understand?
The Queen Mother of Dodowa, Nana Ayeki Yochu III, who is also a health professional, advised women to regularly visit the health facilities to get tested for cervical and breast cancer for early detection and treatment.
When it comes to women's health, that is something dear to my heart, I should say. In my first year, I organized breast screening in my community. That was in my first year because everything about women is something is dear to me because women have a lot of issues. And my belief is that any health condition that can be prevented, that is curable, we need to take it up. We shouldn't wait for it to maybe destroy us or get to the extent that nothing can be done before we rush to the hospital. So that's why I patronize them, and then I inform my women that it is best to seek health care at the early stage. I would just like to advise that whenever there's any screening health program, we should take our time to attend. You don't know, that is where you might realize you have a condition. So every health program, we should have time to take part.
A beneficiary also spoke to Citi News after her screening.
It was fine, yeah. They check everything. At first, I was having those feelings that maybe I have all those kinds of things. So when I came and they checked it for me and they told me there's nothing there, I was like, thank God. So I think it's fine. It's good that they did. And I urge every woman to go and check for those checkups, yeah. And then, yeah.
Health professionals have advised women, especially, to constantly check their cervix and their breast to early detect or prevent cervical cancer and breast cancer for their own good. Reporting for Citi News, my name is Ansheli Zibu.